Hi, Owen. Nice to see you.
Great to see you again.
Over 4 years, it's been around 4.5 years ago, you had a bilateral expanded stem cell therapy to your hips because of the osteoarthritis and injury in that time, and you had some symptoms in that time. You wanted to try alternative therapy with expanded stem cell. How did it go after the stem cell and up until now? Would you mind just give us your experience?
Yeah, 4.5 years ago, I experienced extreme pain in my hips, and I didn't have the money to be able to do an operation. And so,
What do you mean by operation?
Well, the doctor said that I'd have to do full hip reconstruction, and I wasn't keen.
Both sides?
Both sides, yeah. And I didn't have $50,000 for that medical procedure, and so my mum said she was actually watching a program on TV about stem cell. I got excited the possibility because it was non-invasive. They weren't going to cut me open. It was something I really knew nothing about. But 4.5 years on, the procedure, it wasn't invasive. It was great. It was quick. I even filmed it when you were injecting. I'm fit. I'm healthy, and I love where I am at the moment. So yeah.
So you were satisfied with the outcome?
Yes.
Were you expecting that?
I tell you what, I didn't know what to expect because everyone had promised me that if you take this and you take that or you do this, you're going to get better, but nothing seemed to be getting better. It seemed to be getting worse. And so I knew from when I had the procedure, within the first week, something had changed because my pain levels were diminishing because I had no need of utilizing strong painkillers.
So what made you decide on alternative therapy while the therapy is controversial over hip replacement? Is it just the money part? Because hip replacements can be funded by the public hospitals.
Yeah, apparently I was supposed to get the best orthopedic surgeon in the country, and but I had a look at the procedure on the video and they cut me open. I didn't like it because I was also told I might not be able to do weight training or specific sports with snowboarding, bike riding, wakeboarding, walking.
And were you able to achieve that?
Yeah, 4.5 years on, every year I do either Switzerland, I do Austria, and these are double black diamond runs. I have lots of video footage of movement. You possibly couldn't do that with hip problems or lower back problems, whatever you have. You just wouldn't be able to do these mountains. So
I recall that is in that time you did your own research.
Yeah.
And it's the research is say sometimes it works, sometimes doesn't work. What advices do you give in terms of the rehab, exercises, and the diet and things? Do you have any recommendations?
I think you have to listen to the instruction given to you from the doctor, because I'll tell you about how to alleviate pain. I remember being told you have to be physically active. So being physically active myself hasn't been a problem. It was just restarting something that I always wanted to do. So I knew that I had to be flexible, and I knew that my diet had to change because there are specific foods that cause inflammation. And so for me, if I was to give any advice to people, is make sure that you have a stretching program in place and that you're constantly monitoring your diet. So for me, sugar's not good for me, or specific carbs. And if I'm
good enough protein.
Yeah, just healthy proteins, and just trying to stay away from sugar and stuff. I'll eat from time to time, but as soon as I eat that food, I notice a difference in some pain that I get back. But I do get pain because I fall off lots riding bikes and skiing, but I just get back up because I know I'm healed.
Okay. And what do you advise other customers about stem cell therapy, given it's still controversial?
I think before you decide to do invasive medical procedures like full hip replacement, and speaking about hips,
particularly if you're young.
If you're young,
we noticed actually when you're young and active,
yeah,
and not bone on bone, the benefit is could be higher.
Yeah, I
That's
think
what the literature suggests.
I think you have to trust the diagnosis from the doctors when you had a look at the computer, actually what was taking place in my body. Then I immediately went to the how do I stop this from getting any worse? So for me, I had to do active physical therapy like weight loss.
I'm glad it went well for you,
Yeah,
and I wish you the very best.
thank you very much.